Mimi hapa nimejawa na hofu kwa sababu waziri, najua kwa muda sasa umekuwa ukitengamana na watu wengi sana. Ningependa kujua kama umechukua hatua ya kwenda kujifikisha kwa kituo cha afya kuangaliwa hali yako ya afya, kwa sababu sikuombei na ugonjwa, lakini
asante sana ndugu yangu. Nimeshukuru kwa sababu mimi nadhania utaendelea kuniombea na mimi pia nitakuombea, lakini hebu nikueleze hapa ni lazima tunaendelea kupimwa mara kadhaa, kwa sababu kama wewe kama ulivyosema, tunatembea sana, tunaenda mahospitali, tunaenda pengine iko na wagonjwa, ndio tunatumia mask, vile vile tunapimwa. Wewe umepimwa? Hata mimi nimepimwa, sio mara moja, mara kadhaa. Lakini ile kitu mzuri ni kwamba badala ya kugoja kupimwa, wewe jikinge sana na uweke Mungu mbele. Uweke Mungu mbele na ujikinge. Hiyo ndio kitu ya maana. Am I concerned that law enforcement officers are taking people's lives? I'm not aware. Who are those who are taking people's lives? Because if they are, then obviously the law must follow its course. And when you say taking people's lives, I don't know whether you mean by killing them. I don't know whether you mean by allowing infected people to infuse themselves with them. I don't know. But in any event, notwithstanding what the meaning of the question was, is that the law must always and at all times be followed. Otherwise, if we didn't follow the law, then it would be anarchy. And anarchy leads to disorder, and disorder benefits nobody. So, yes, I would like to see a system where on the roadblocks, I would like to hear that as many people as possible have been stopped, and are parked on the side until they go and acquire the necessary documentation that they are supposed to. But as you know, and to be honest, let's not bury our heads into the ground like the proverbial ostrich. It is true that amongst even enforcement officers, we do have people, who are breaking the law. It is a fact. But we have, as a government, taken measures where this has been the case, just like we have taken measures against health officers who do not adhere to what we have said. So asanteni sana, thank you very much indeed. Sasa respond to that. I'm not aware of it.
And secondly, the breakdown of the active cases that you have now so far. How many in hospital? How many cannot be accounted for? How many have
Let me start by saying there is none that can't be accounted for. Then I pass it on to Dr. Amo to respond with the details.
Thank you, Waziri. In terms of, we can be able to account for everybody based on the cumulative numbers that we have had. And on the cumulative numbers, you look at the index test, the first test. And then out of that, of course, you minus the negatives, then you remain with the positive cases. Then the positive cases, you minus the deaths, the recoveries or the discharges. You minus those who are repatriated. And this difficult group of people who gave us the wrong contacts. And as Waziri has said, you are on track to be able to catch up with them. And we are making good progress. So in terms of accounting for all the people who are in the line list, we can, and we can be able to share that information with you. As we shared with you last week on Friday, of course, as the numbers increase, the figures change. But basically that is the permutation. That you have the positive cases, you minus the deaths, discharges, the repatriated people, those who are on self-isolation, either pregnant mothers who cannot be isolated in a facility, or mothers with very young children who cannot be isolated in a facility, based on a risk profiling that we have done. Then, and also those who came from outside the country, those who went for treatment. Even as of today, we get requests for people who went for treatment in India, for cancer, for serious surgery. When they are back, those are not people that you can put in the isolation facility. you do a risk profiling or a risk mapping, and based on that, together with their primary care physicians, they are best served at home in a home-based isolation facility. But beyond that, we are also exploring the possibility of community-based isolation. And Waziri, allow me just to highlight something about home-based care that you are going to launch very soon, probably by the end of this week or early next week. And this is a key intervention that is approved by the World Health Organization, and it is meant to decongest health facilities and prevent the healthcare systems from being overwhelmed. Remember, majority of our cases are asymptomatic. So it makes no business sense to be able to manage these people in a hospital facility. You can be able to manage them in a home-based isolation facility or a community-based isolation facility based on that risk mapping. And this has worked very well before. You remember during the early days of HIV, the pandemic, low middle-income countries were able to quite well work out on the intervention of home-based care with very, very good success. And also because we are going to carry out behavior change communication to the community so that we have their buy-in, we believe that we should all succeed together in this. Remember also, as a clinician, patients recover best at home because they are more familiar with the home environment rather than a hospital-based facility. Thank you.